Welcome for the second part of a two-part series on exercise for brain tumor patients led by Dr. Nicholas Gonzalez Castro, Director of the Neuro-Oncology Wellbeing Program. Dr. Gonzalez Castro is a neuro-oncologist at the Dana-Farber Center for Neuro-Oncology and an associate neurologist at the Brigham and Women's Hospital. In addition, Dr. Gonzalez Castro is also a certified personal trainer under the American College of Sports Medicine and has received the Exercise is Medicine certification from the same organization. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the Now team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat or the Q&A feature throughout the session. At the end, your questions will be used to moderate a Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center, or you can email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I wanted to remind you that this program is made available for educational purposes only, and that the information presented is not intended to substitute the recommendations of your personal physicians or other qualified healthcare providers. I will now pass the workshop over to Dr. Gonzalez Castro.
Thank you, Becca, for the introduction, and thank you all for joining us today for this second part of a two-part series webinar on exercise for brain tumor patients. I'm Dr. Gonzalez Castro from the Center for Neuro-Oncology at Dana-Farber. I'm from the Neuro-Oncology Wellness Now program. These are some disclosures that are not relevant to the contents of the presentation, but I would like to put them out. And before we dive in, I would like to take a minute to tell you about the Neuro-Oncology Wellness or Now program and what the program is all about. We here at the Center for Neuro-Oncology are devoted to the care of brain tumor patients, and we spend many hours with patients in the clinic and when they're here in the hospital discussing the treatment of their specific diagnosis, a specific brain tumor. But we wanted to find ways to support our patients beyond the hospital, beyond the clinic, and this is essentially the reason why we launched this program. So we see three different elements that are important to supporting our patients, and one of them is patient education, helping our patients understand their disease, their diagnosis, and help them understand treatments and treatment options, and not only educate our patients, but their caregivers so that they can support the loved ones in the best possible way. In addition to that, we're interested in patient physical and emotional health beyond the treatment of the brain tumor. And this offering today on exercise for brain tumor patients is along this specific axis of development, trying to help our patients be the healthiest patients that they can be through the course of their disease, to help manage not only the complications that are caused by their diagnosis, but also help manage the complications that are caused by the treatments that we often offer or any other health problems that they encounter in their daily lives. So we are going to talk about exercise today, and in the future, we hope to talk also about mindfulness and management of stress, as well as other things that patients can control in their day-to-day lives to improve their overall well-being. And the last element or the last axis of development that we see for our patients is to help them be part of a community of caregivers, a community of patients that are working through their diseases and are, tackling their diagnosis and trying to move forward and carry on with their lives. So we have support groups both for high-grade and low-grade glioma that meet regularly, where our patients can meet other patients, understand their specific situation, and share their own experiences. And in a way, with each other, try to find strategies to move forward through their diagnosis. There's this old saying that when you share a problem with a friend or with a loved one, do you divide it in half? And I think that there is truth to that, and many of our patients that join our support groups find these very rewarding, both in terms of what they receive, but also in terms of what they give to support other patients. So I encourage you to consider these offerings. And now, getting back into our topic for today, which is exercise for brain tumor patients, I would like to do a very brief recap of what we discussed in the first one of these 2 episodes. And there we talked about what exercise is. We tried to define it in a formal way. You know, it's difficult to engage in a specific activity if we don't know exactly what is it that we're talking about. So we'll talk about that briefly today, and also try to remind you of the benefits of exercise, of physical exercise for cancer patients, for brain tumor patients specifically, and also for everybody else. And then the major part of this presentation today will be to talk about some of the specifics of the components of an exercise program. And what are the things that you need to keep in mind? This is not a prescriptive program. We're not going to tell you what you need to do and how you need to do it, because we just cannot do that in this forum. But we want to give you information so that when you go see your physician next time, or when you meet with a physical therapist, or when you meet with a trainer, you'll be informed and prepared to help them understand where you stand and what are the needs that you have learned about through this program that need to be addressed as part of your exercise program. Then we'll talk a little bit about, what is the best time to start an exercise program, and we will dive right in with some of the recap from the previous session where we talked about what exercise is. So exercise, formally defined, is a type of physical activity consisting of planned, structured, and repetitive bodily movement done to improve and or maintain one or more components of physical fitness. And then we explained that there are 2 different domains of physical fitness: the health-related physical fitness components and the skill-related physical fitness components. And we have all heard about these, but it's important to understand that certain type of physical exercise can help with cardiorespiratory endurance, can help with body composition, the amount of muscle versus fat, and the strength of bone and other tissues in the body, can help with muscle strength, the amount of force that we can exert, and then also can help with muscle endurance, which is the ability to exert force over a period of time. And lastly, flexibility, the ability to move an extremity through the range of motion of a specific joint. Then there are skill-related physical activity components, and these deal with the ability of the nervous system as well as our musculoskeletal system to integrate and be able to perform certain activities with certain qualities. For example, agility, being able to quickly change position, coordination, being able to integrate different movements of different body parts, balance, the ability to maintain equilibrium when ambulating or when standing, power, the ability to exert force with a certain amount of speed, reaction time, the ability to respond to different stimuli, and then speed itself, the ability to perform a movement during a short period of time or a shorter period of time. So when we are engaging in an exercise program, we're trying to develop both our health-related physical fitness components as well as our skill-related physical fitness components. And then the next thing that we discuss is why, what are the benefits that we can obtain through participation in an exercise program. And I'm not going to discuss all of them in detail, but the benefits of exercise are multiple. And I mentioned at the last webinar that if exercise were a drug, it would be the most effective drug that we have ever developed. More effective than any treatment that you can buy at a pharmacy or get prescribed at a hospital, because of the number of positive effects that have in multiple systems of the body. from the central nervous system, to the cardiovascular system, respiratory system, musculoskeletal system. And these are all listed here, which are just bullet points of multiple studies that have been done to study this. So there are known improvements in cardiovascular and respiratory function. There are known reductions in cardiovascular disease risk factors. There is clear evidence of decreased morbidity and mortality. So, how sick we become from certain illnesses, and how likely are we to die from the effects of certain conditions if we engage in exercise versus if we don't engage in exercise, as well as other benefits in terms of helping cognition and mood and overall well-being for patients. So, there are many studies that have looked at all these different aspects, but it's important to keep in mind that we tend to narrow our view. It's like when we do a particular physical exercise, we're expecting a single benefit, and in reality, we are able to obtain multiple benefits through it. So now I wanted to get into the details of how to go about starting an exercise program. And I will start with a disclaimer, and I mentioned this, that this is not a prescriptive program. I'm not going to tell you how to go about starting your own specific exercise program. This requires a one-on-one consultation where first, a clinician or other healthcare and exercise provider is able to evaluate you in terms of safety to start an exercise program, and then make a number of other assessments to recommend what is safe for you. So today we're going to be talking about general principles, and this is a foundational one, that although most exercise programs do not usually lead to injury, you must consult with your physician before starting one, because they might have information that you are not aware about, specific conditions that you might have and you might have been diagnosed and might not be at the forefront of your mind in light of your cancer diagnosis. You're thinking about that specifically, and you're not thinking about other conditions that might preclude you from engaging in an exercise program, or might necessitate the modification of your exercise program. So I think that in this day and age, given the multiple benefits of exercise, most patients that have a certain degree of physical function can engage in an exercise program, but it's always important to consult with a physician. Another thing that is very important is to build up and go slow in terms of building up your exercise program, so that you allow for adaptation of your body and your body systems to the stress of exercise. Exercise is a stimulus to which the body responds, and we obtain the health benefits of exercise through the adaptations to these stimuli that are felt through the exercise program. So if you set goals that are too ambitious, or if you start at a very high level of intensity, we discussed the concept of intensity in the first seminar, but it's how hard it is to do a specific activity. And I encourage you to watch part 1 to learn more about that, and look at the table of different activities and intensities that we discussed. Or too much volume, maybe doing too much exercise, too many minutes per day, too many days a week. You might run into problems. You might run into injury. You might run into very excessive fatigue that will prevent you from giving continuity to your exercise program. So do not be too ambitious, and work with a physician or a physical therapist or a personal trainer that will help you develop a program that will scale up to the right level. So I give the example here. If you have not been doing much, you have been just going about your life, and then you decide that you want to run the Boston Marathon next April, I think that's a very ambitious goal. Maybe you can set a goal of running a 5K in a few months. All depends on your level of fitness. But going from 0 to Boston Marathon is not a reasonable goal, or at least one that will lead you to continuing with a regular exercise program in a safe way. I mentioned this already, which is that we need help in designing an exercise program that addresses multiple components, and we're going to move on into these components specifically. But essentially, we want to address cardiorespiratory endurance, muscle endurance, muscle strength, and flexibility. So I think it's important to work with a physician that has knowledge of these aspects and can help you give you an exercise prescription. This is something that can be provided, and some physicians that have had exposure to exercise medicine can give you an exercise prescription, or if not, working with a physical therapist or a personal trainer. How much and what types of exercises you should be engaging in is a central question, and the answer is a nuanced one. It's one that requires discussion of different aspects, and this is from the exercise recommendations for specific health-related outcomes in patients with cancer. This was developed by the American College of Sports Medicine and is all evidence-based. So these are recommendations that are guided by studies where patients were asked to participate in different exercise programs that included aerobic and resistance exercise, or a combination of the two, and benefits were observed. So, I don't want to get into the specific details, but you will see that, for most symptoms, including cancer-related fatigue, health-related quality of life, physical function, management of anxiety and depression, there are two components, the aerobic one and the resistance one. And for the aerobic component, they're prescribing a number of things. One is the frequency per week, 2, 3, 4 times a week, the duration of the exercise in minutes, as well as the intensity. And we will see this in other prescriptions. In the resistance column, you will see that they're prescribing the frequency in terms of number of days per week, usually 2 to 3 times per week. And then they're listing a number of sets. A set is the number of repetitions, the number of group repetitions that you will perform for an exercise. So for example, if you are doing sit-ups and you are doing sets, you will usually do a certain number of sit-ups, let's say 12 sit-ups, and then you repeat that one more time. That's 2 sets of 12 sit-ups. So the set is the group number of repetitions you perform as part of an exercise session. So, in the resistance training column, the recommendation is usually 2 to 3 sessions per week, including 2 sets of repetitions that range between 8 and 15. And we will get into a little bit more detail in terms of what is the variable that we're trying to modulate there with the number of repetitions, what is to be gained by doing less repetitions versus more repetitions, and then also targeting major muscle groups. And then the combination involves both aerobic exercise and resistance exercise. You will see also that for some interventions, there is no sufficient evidence to make a recommendation. So for example, for anxiety and depression, for the management of mood conditions, most of the studies have relied on aerobic exercise and not on resistance training. I think a good place to start, and I will say also that there are no guidelines for brain tumor patients. This has not been studied carefully in the adult or pediatric brain tumor population. So we don't have guidelines that are specific for brain tumor patients. But I think a reasonable place to start, and this can be modified based on the physical function of different patients, are the general guidelines that the U.S. Department of Health and Human Services puts out, through the Office of the Surgeon General. And these guidelines also emphasize both the aerobic aspect of exercise, looking at cardiorespiratory endurance, and then looking at resistance training to achieve, good levels of muscle strength and muscle endurance. So for the aerobic part, the recommendation is for adults to do at least 150 minutes. This is 2.5 hours. This is about 20 minutes per day if you exercise every day. So a minimum 150 to 300 minutes. So between 2.5 and 5 hours of exercise a week at a moderate intensity. Okay. So if we go back to the first episode and look at the concept of METs, this is, for example, walking at a moderate pace, not just, taking a very casual stroll, but, walking at a pace that allows your heart rate to be increased from its baseline, beyond what you achieve sometimes by doing normal walking. The intensity will also depend on your level or of cardiorespiratory fitness. So, for a patient that has not been able to walk for a long period of time, just, a very slow walking pace can get them to relatively high intensity. So all these things need to be tailored. But for patients that have normal mobility, this is walking at a good pace. It's not running. If we go into running, that's into the category of vigorous activity, but it is walking at a reasonable fast pace, one that will increase your heart rate. So 150 minutes to 300 minutes, 2.5 hours to 5 hours of moderate intensity exercise throughout the week, or 75 minutes to 150 minutes. So this is half of the other range, 1 hour and 15 minutes to 2.5 hours, if you engage in vigorous intensity physical activity. So for example, if you're jogging or running, that's when you get to 6 METs or so, and you're exercising at a higher level, and you can achieve the benefits in terms of stressing your cardiorespiratory system and inducing these adaptations that are beneficial for overall health, doing less time if you do it at a higher intensity. If you have more time, if you're able, you would gain additional benefit if you are able to exercise more. So we know that, for example, patients that are exercising at moderate intensity, if you're able to exercise more than 300 minutes per week, they will gain additional benefit. And I will get into the data on maximum the maximum rate of consumption of oxygen, of VO2 max, and how that is correlated with overall mortality, and how by exercising for longer periods of time, you can improve that variable, VO2 max, and how that is related to health benefits, including a reduction in overall mortality. Lastly, the general guidelines for adults also recommend muscle strengthening activities of moderate or greater intensity that involve all major muscle groups on 2 or more days a week, as these provide additional health benefits in addition to the improvements in cardiorespiratory endurance that are obtained through the aerobic exercise that we discussed on the previous 2 points. So just to keep in mind and to summarize, we want to have at least 150 to 300 minutes, 20 to 40 minutes per day or so of moderate intensity exercise, or instead of that, half the time, but increase the intensity. And in addition to that, we want to do resistance training, muscle strengthening activities 2 to 3 times a week. So let's talk about cardiorespiratory endurance. And this is the development of our heart and our vascular system and our respiratory system working in coordination to provide adequate nutrition and adequate removal of waste products that are generated by the muscles during physical activity to enable continuous physical activity during exercise and then beyond exercise to improve our overall cardiorespiratory function. So this is the base of the fitness pyramid. There's this idea of training in different zones and being able to obtain different benefits depending on the zone that you're training, and this is related also to the intensity of exercise. But there are a number of studies that highlight the benefits of training at what is called zone 2, which is the next zone beyond the one where you're just engaging in activity at a level that you're not really taxing your overall cardiorespiratory system. So your muscles are working in a way that they can make most of the use of their oxygen and barely generate waste products. There's this idea of muscle consuming both oxygen and glucose to produce energy, and as a result producing a byproduct called lactate that has a number of different functions. Traditionally was thought of being a waste product, but we know that has a number of different functions, and it can also be used as a source of fuel for muscle. But it's something that we can track and can be tracked to try to determine at what zone you're exercising. So if you're exercising at a level where you're producing some lactate but not too much, you're making your heart work at between 60 and 80% of your maximum heart rate, which you can estimate in a rough way as 220 minus your age. So for example, if you're 50 years old and you use this formula, your maximum heart rate for a 50-year-old would be about 170. This is not a perfect formula, and your maximum heart rate can vary based on your level of fitness and a number of other variables, but it's a rough way to estimate it. So for someone that is 50 years old, has a maximum heart rate of 170, then if you're training at 80% of your maximum heart rate, you're more or less training at a heart rate of around 145 or so, or 140 to 145, and then you wouldn't want to go beyond that, because if you do that, you will be engaging other energy systems that are helpful for other adaptations related to physical training, but they're not necessary for you to achieve the benefits of exercise that you want to achieve for overall well-being and physical function. I want to stress here that we are not trying to get brain tumor patients to be competitive athletes. There's nothing wrong if patients want to pursue that, but the goal here is to engage in an activity that can be done with continuity over time that will yield health benefits, but that will not be overly taxing. Training at a heart rate that is higher than 80% first is something that should be done by someone that has a high level of fitness, and something that will be very taxing and probably not to be tolerated by most patients that have not been exercising before. So again, try to target your training to 60 to 80% of your maximum heart rate if you can. If you cannot, you can exercise at a lower level of intensity and you would still be getting some benefit. but this range here is thought to contribute the most to helping your cardiovascular system and to you developing metabolic efficiency. Training in this range, as I mentioned, will help improve the efficiency of your muscles, their ability to extract oxygen and other nutrients from the blood and process them in a way that doesn't produce excessive amounts of lactic acid. And then, the rate of the maximum rate of oxygen consumption by the muscle, the VO2 max, is associated with lower mortality. So the higher your VO2 max, the lower your mortality risk, in general population, but the benefit also translates to cancer patients. So here you see, this is a table that lists the levels of VO2 max for different ages, as patients having or individuals having low levels of VO2 max, below average, above average, high, or elite levels, if they were to be competitive athletes. And there are different age ranges by decade. And these are tables for men and women. And what they're plotting here is the hazard ratio. So the improvement in your risk of dying, all-cause mortality of any causes, as a function of your VO2 max. So the higher the level of your VO2 max, above average, is improved over below average, and high is improved over above average, and then elite is even lower. So the higher your VO2 max, the lower your overall risk of all-cause mortality. And this is the benefit that we're trying to achieve by working on our cardiorespiratory endurance. The next area, and this is related to the recommendation regarding resistance training or muscle strengthening exercises, is muscle endurance and strength. And muscle endurance and strength are also correlated with metabolic health and decreased mortality. And it's important to note that muscle mass decreases at a rate of approximately 3 to 8% per decade after the age of 30. And this rate of decline is even higher after the age of 60. There is this concept of sarcopenia. Sarco means fleshy tissues, bone, muscle, and as we start to age, these become muscles become smaller and able to produce less force often. Bones become more brittle, and this taken together improve cause an impairment in our musculoskeletal system that puts us at increased risk of worsening balance, falls, fractures, and all the complications that are associated with these things, as well as a reduction in our overall ability to perform certain tasks, such as lift certain weights, be able to carry our groceries, do certain activities of daily life that we might have been able to do at a younger age. Once we start aging, if we don't do anything to maintain our muscle strength and endurance, our musculoskeletal system will lose its ability to perform certain activities. And that is why it's important to do resistance exercise to maintain these activities. The key here when performing resistance training is to focus on complex, these are functional exercises that involve multiple muscle groups. So instead of trying to isolate, for example, the biceps, the muscle of the arm, and strengthen that, it's more important to try to do an exercise that involves other muscles in the arm, and that is more similar to a movement that we might need for our day-to-day life. So instead of maybe just flexing the arm or working this arm, maybe doing a complex movement that also involves muscles of the forearm, muscles of the hand, muscles of the shoulder, and in that way, be able to develop multiple muscles at the same time, and help our nervous system work on the integration of the activity of all these muscles. Because in day-to-day life, it's rare for us to do activities when we're activating only one specific muscle. So it's important to work on complex exercises, which are more in line with day-to-day functional activities. Another very important point where when doing resistance training, to avoid injury and to get the greatest benefit of the exercises is to develop good form. And there are a great amount of resources nowadays online, on websites, specialized websites, that will show you how to perform an exercise safely, with good form, and in a way that will help you prevent injury. So the other thing that we mentioned is, we want to involve multiple muscles, but we also want to involve large muscle groups. Work on our legs, our glutes, muscles that are, large in size and are involved with activities that are related to stability and balance. Strengthen those. These are the muscles that can help us get up from a chair. Muscles that can help us get up from the floor if we experience a fall. And then the last thing, you notice that in the table that I was showing you on different exercise recommendations for different cancer-related health outcomes, they were talking about the number of sets and repetitions. And the important thing here is to adjust the number of sets and repetitions based on your training goals. So usually if you're trying to work on strength, you go for a lower number of repetitions with a higher weight. If you're trying to go for hypertrophy, trying to increase muscle volume as a way to work against the process of sarcopenia, the decay that we all experience in muscle volume as we age, then you would go for an intermediate weight. And hypertrophy usually calls for a number of repetitions that goes between 8 to 12. And it's not that at 13 you're already moving into the endurance range. These are all some general guidelines. But then endurance is something that we experience if we're doing an exercise with low weight and we're doing 15 or more repetitions. So, like I said, it's not that you're only achieving endurance if you're doing 15 or more repetitions with a low weight. You will also achieve certain improvements in terms of strength. You will also achieve certain improvements in terms of hypertrophy or growth, muscle growth. However, if you're at one particular end of the range, you would get mostly that benefit, either endurance or strength. If you're in the middle, you will get, muscle growth as well as improvements in strength and endurance. But, this is just to give you a general idea of the principle that, lower number of repetitions with increased load or increased weight is more associated with strength, and greater number of repetitions with a lower load or lower weight is associated with endurance mostly. And then in the middle, you're looking at hypertrophy. Another important aspect, and one that is often overlooked, is flexibility. The ability to move an extremity through the range of motion of the joint. We have seen either in ourselves or in relatives that we start losing range of motion. We start losing range of motion at our ankles, for example, at our shoulders, and sometimes we cannot reach something that is on a high shelf because our shoulder is no longer able to reach out all the way. And to maintain this, it's important to work on flexibility exercises. And flexibility is another, element that in our natural development peaks at a young age, usually at around age 24, 25, and starts to decrease afterwards. So it's important that in our exercise routine, we incorporate dynamic stretches. These are not what we think of in terms of stretching in general, which is, uh, going through a particular posture, stretching over a joint and then maintaining that. This is a movement through the joint, and it's an active movement that helps slowly warm up the joint and increase the range of motion. Usually, and this is most important, to be done at the beginning of an exercise routine, both aerobic exercise and resistance training. We need to start by warming up with some dynamic stretches. The static stretches, what we usually associate when we're stretching, kind of like leaning forward and touching our toes with our legs straight, should only be performed when muscles and joints are warm. Usually towards the end of an exercise session. The important thing to know also is that in order to achieve benefits in terms of flexibility, we do not need to stretch our muscles for a long period of time. As with everything else in exercise, the key is consistency. The key is doing things regularly and consistently. So total time of stretching per muscle should be about 20 to 40 seconds. And there's no additional benefit by stretching a longer period of time. Unlike with respiratory endurance, where we saw that, if you were exercising at a moderate intensity for 300 minutes, you get a benefit. And then if you exercise more than that, you get additional benefit. Here, if you stretch the muscle for 20 to 40 seconds, that should be enough for you to get the benefit in terms of flexibility. So you should not spend, an extensive amount of time stretching, which means that you can incorporate stretching to most of your exercise sessions and not increase the time required for this by any significant amount. So I want to discuss also the idea of when is the best time to exercise. So there's a Chinese proverb that says that the best time to plant a tree was 20 years ago, and the next best time is today. So if you're not exercising already and you are a patient at our center or anywhere else, and you have not been engaging in exercise, today is the time to start. I think I show you some data from a study published in 2011 looking at patients with glioma, with high-grade glioma, and the benefit of exercise for those patients. And in that group, there were patients that had already been exercising before the diagnosis, and then patients that started after the diagnosis, and both groups benefited. So if you're not exercising, I think today, October 11, 2023, is a great day to make a commitment to start an exercise program. Then the main contraindications for exercise in brain tumor patients are in the post-operative period. As we have discussed in some of our disease-oriented webinars, most of our patients present to medical care because of neurologic symptoms, often because of seizures. A brain lesion is identified, they undergo a surgical resection of the mass or surgical biopsy of the mass, where a neurosurgeon needs to make a window into a skull and remove tissue, and those tissues then need to be closed afterwards, and healing needs to take place there. So to allow for adequate healing of that area, patients are told not to exercise right after an operation, and that is good advice, particularly doing high intensity exercise, high intensity resistance training, lifting a lot of weight. If you have had an operation, or if a loved one had an operation, you probably remember that you were given a list of things not to do shortly after your operation. So, engaging in high intensity exercise, lifting heavy weight after an operation is a no-no. Also, in patients with limited mobility that either due to their tumor or treatments that they have received after their operation have experienced persistent weakness in one area of their body that can affect their physical function. It is not intuitive how those patients can engage in an exercise program. They should get specific recommendations and specific help from physical therapists or trainers, personal trainers that have had training in helping develop exercise programs for patients with limited mobility. You should not go on your own, buy a gym membership and try to do it on your own, because you could possibly, worsen your overall physical function or through injury. So if you have limited mobility and this is persistent, you need to work with a physical therapist to help you develop an exercise program. So another important consideration, since seizures are very common in our patient population, is that patients should be very careful when engaging with exercise if they have uncontrolled seizures. And actually, my recommendation would be not to engage in specific types of exercise if they're having repeated seizures that cannot be controlled. The best approach is to not exercise when patients have uncontrolled seizures, and then work with your neuro-oncologist to achieve good seizure control. I will tell you a little bit more about seizures and headaches, which are important considerations in brain tumor patients. But overall, I would say after an operation, do not exercise until cleared by your neurosurgeon. If you have persistent limited mobility, you should work with a physical therapist to help get a dedicated, specific physical exercise program. And in patients with uncontrolled seizures, the best recommendation is for them not to engage in exercise until their seizures are well controlled, because of the high risk of injury if they were to experience a seizure while exercising. Exercise during radiation, however, is encouraged, and I encourage it in all my patients. Again, if all the other issues that we discussed above are well managed, exercise during radiation can help reduce radiation-induced fatigue. So most patients that are receiving radiation, about 2/3 into their radiation course, patients that get 6 weeks, usually around week 4, they start complaining of fatigue, of feeling tired, of not having enough energy. And exercise during radiation can help mitigate this, and this has been studied in a number of patient populations, brain tumors, and also in patients with other forms of cancer. Exercise can also help with chemotherapy-induced fatigue. Not as commonly as with radiation, patients can develop fatigue while taking their chemotherapy, while completing their chemotherapy cycles. And exercise can help with the management of that symptom. And in terms of when in the day, I always make the recommendation that if you are able to exercise in the morning, it is the best possible approach. Because since exercise is probably the best thing that you can do for yourself, it should be a high priority item in your schedule. And if you can do it right away or soon at the beginning of the day, then you just check that win for the day and move forward. There are also some data that note that there is a metabolic and mortality benefit by exercising in the morning. So that's also to be considered. So if your schedule allows, if logistically possible, I would recommend exercising in the morning. If you can't, it's also appropriate to exercise in the afternoon or exercise in the evening. And you should not, if you say, well, I cannot exercise in the morning, so I just give up on this. No, do not do that. By all means, try to exercise. When I cannot exercise in the morning, I exercise in the evening, when I have time late at night. And the most important thing is that you get your exercise in every day if you're able. And then if you are not exercising regularly, if you do not have the habit of exercising, I think it's important to look into programming yourself into developing the habit of exercise. And this is a little summary of some of the lessons to be learned from a terrific book that is called Atomic Habits. This was published by an author named James Clear back in 2018. And it talks about how, many of the things that we do throughout our day are just ingrained activities that are the response to certain cues that we receive and that we perform without any conscious awareness. So, for example, in this day and age that we rely on our cell phones so much, it is not uncommon for us to have our cell phone charging at our nightstand. And the first thing in the morning, the first thing that we do in the morning upon waking up is just we grab our cell phone and we start looking at it. So that's a habit. We have other habits, for example, that when it's getting dark and we're about to go to bed, we get into our bedroom and just we get into our bathroom and brush our teeth, and we don't have to think, we don't have to plan, we don't have to schedule for that because it's something that is ingrained. So that's another thing. So the key to develop a habit is to make it obvious, to make it attractive, to make it easy, and to make it satisfying. And I would encourage you to, look into, creating cues. For example, setting a time and a location that is specific. Putting your exercise clothes out in a place where you will just see them. Make the exercise something attractive. Exercise in a place that you like. Exercise with someone that you like. Sometimes having an exercise body makes it easier and more fun to exercise. Make it easy at the beginning. Like I mentioned at the beginning of the presentation, do not be too ambitious in terms of your goals. The key thing is to get it done every day, and then make it satisfying. Find some form of reward. There are plenty of rewards to be gleaned in terms of health and overall well-being from exercise, but reward yourself, after you exercise by, either tracking your progress or checking the calendar, making sure that you exercise. Take a picture of yourself, share it with your friends, post it. Do different things that can help reinforce the habit and improve the likelihood that you will continue to engage with the activity. So, I mentioned this earlier, that you should consult with your physician before starting an exercise program. You should get help from a professional, either a physician, a physical therapist, or a trainer, to design a program that involves all the necessary aspects of exercise: cardiorespiratory endurance, muscle strength, and flexibility. Try to exercise at the same time every day. It's important to schedule it and get it into your schedule. This helps form the habit. Select a cue to make it into a habit. Try to exercise with others. And know that it's okay to take days off, but keep in mind that the benefits of exercise are accrued through consistent participation. So, one day you miss out, your run or, your strength exercises at home or at the gym, it's okay. Just, make sure that you get in your exercise the next day. I wanted to have a word about, the two considerations that are important for brain tumor patients. One is seizures, and the other one is headaches. So an important question is, does participation in exercise increase seizure frequency or leads to poor seizure control? So the first point that I want to make is one that I made a little while ago, which is if you have not achieved seizure control, if you have not made your seizures go away with medication, then you need to work with your neuro-oncologist to make sure you achieve good seizure control before you continue. You decide to engage in an exercise program. If you have well-controlled seizures, participating in physical exercise does not increase the rate of seizures. This has been studied in a number of studies and aggregations of multiple studies called meta-analyses. And the general consensus, this is from a study published in the journal of Seizure in 2015, is that there should be no restrictions to the practice of physical exercise in people with controlled epilepsy, except for things that are high risk. So for example, scuba diving or skydiving. I would add to this, open water swimming without a partner, or other sports at heights, like climbing, because although you have achieved seizure control, you're never 100% sure that you will not have another seizure. But if your seizures have been well controlled, exercising in an exercise program like the one we have described here, 20 to 30 to 40 minutes of moderate intensity aerobic exercise 2 to 3 times a week of resistance training should not be a problem and should not lead an increase in the number of seizures. And then in terms of headaches, patients have headaches for different reasons. And in most cases, headaches, even in brain tumor patients, are unrelated to the tumor itself. And this has been studied for different headache types, but for migraine, which are a very common type of headaches that many individuals experience, it's been known that if you engage in aerobic exercise over time, you will have a reduction in the number of seizures and in the intensity of seizure. I'm sorry, in the number of headaches and in the intensity of headaches. So do not shy away from participating in exercise, particularly aerobic exercise, if you have frequent headaches or you have migraines and you think these are going to get worse. In fact, it will be the opposite. Oftentimes, if you exercise regularly, your headaches will be less frequent and of lower intensity. One last thing in terms of implementation, we have a wonderful center here at Dana-Farber, the Leonard Sakim Center for Integrated Therapies and Healthy Living. And I encourage you to visit the website that I listed there. They have a number of exercise classes that address many of the areas that we have discussed today, aerobic cardio workout, yoga, which is a great exercise to work on both strength and flexibility and balance. And some of these, many of these offerings are available online, and you can just, participate from home, and many of them are recorded and you can do them at a time that works for you. Some of them are live, many are recorded. So I encourage you to visit this resource. This is available to all of our patients, and engage in some of those classes. In summary, we know that there's evidence that exercise is helpful, period. But in addition, we know that it's helpful to cancer patients, including brain tumor patients. And for brain tumor patients, the studies that are available show that increased exercise capacity correlates with improved overall survival. And improved exercise capacity also correlates with a number of measures of quality of life, particularly fatigue, and possibly an improvement in cognition, on thinking. So the more exercise you do, the more you can preserve your thinking. I cannot emphasize it enough. Please talk to your neuro-oncologist, to your physician before starting an exercise program, and then work with therapists or trainers or your physician if he or she have experience in designing an exercise program that addresses cardiorespiratory endurance, muscle strength, and flexibility. And if you haven't already, please email us at dfci now, dfci.harvard.edu, to receive more information on our programs. And now I'll be happy to answer any questions that might be here on the Q&A, or any questions that you might want to list now. So if you want to use the chat feature, I'm happy to answer questions that way. There's also the Q&A feature. where you can list questions. And if there are no questions at this time, you can email us at dfci@dfci.harvard.edu, and I'll be happy to follow up and help you address whatever question you have. Actually, I think one came in. Will the slide deck be available online? So the whole presentation will be available online and will be probably uploaded to the DFCI YouTube channel later this week. So I see Becca is nodding, so you can rewatch the whole presentation in a few days.
Yes, exactly. Once this is edited, we are going to be posting it to the YouTube playlist. It's our Blum YouTube playlist. It's on the Dana-Farber YouTube channel, so you can be sure to watch that. And we have all of our other sessions of this program also on the YouTube playlist and our Digital Resource Center. So there's a lot more out there for from the Now team.
Well, I want to thank you all for joining us today. I hope that you learn some useful things in terms of exercise and starting an exercise program. And if you are not exercising already, I hope you will be determined now to start your exercise program. Trust that you will obtain many, many benefits through your participation in exercise.
Thank you so much. This was great as always. Have a good day, everybody.
Bye-bye.